Benign prostatic hyperplasia, it's also called by the term BPH. It is a disease that affects men over the age of 45. It is very common, but extremely common in the age of after the 4th to 5th decades of life. In fact, it is a form of normal physiology where the gland enlarges. As the age advances, the gland enlarges, and so the symptoms also is very slow and insidious. The common symptom would be frequency of urination. That is, a person notices that he has to get up at least once or twice at night to pass urine. This is the earliest sign of the disease called the BPH. And the next symptom would be poor stream or hesitancy. Now, what I mean by the word hesitancy is the patient has to wait for a few seconds or even a minute before he can start the act of micturition. And then he notices that the stream is very poor, the force is very poor, and soon he notices that his bladder emptying is not complete. In the sense, he is not satisfied after he passes urine. So what happens is, every half an hour he has to go to the toilet to pass urine, and this is what we call as frequency. So the second symptom after hesitancy would be frequency, and this goes on for maybe a month to years together, and then comes the most troubling. This is what we call as urgency. Urgency means the moment somebody wants to pass urine, he cannot control himself. He has to rush to the toilet, and in case there is some delay, he even notices that he is wetting his garments, and this is called urge incontinence. And the last would be acute retention, where the patient says he is in distress, he is in agony, he cannot pass urine, the bladder is distended, so he has to be rushed to the casualty, and to relieve this they have to pass in a tube called a catheter, and this is the final stage where the patient comes to the doctor or to the hospital. So it is better not to wait until you reach this last stage. As soon as you notice that you have symptoms suggestive of this BPH, it is the best thing to always have an opinion from a urologist, because now these days the diagnosis is so simple and easy. Just by doing an ultrasound or by doing some common investigations, this disease can be very, very easily picked up.